An average of 4,000 people sought medical help from emergency services in public hospital each day during this long weekend. That's according to the hospital authority, which expects the demand will further go up tomorrow. Authorities have urged patients with mild symptoms to turn to private clinics instead. Memo Sangai has details.
Over the New Year holidays, many residents went to the accident and emergency departments of public hospitals to seek medical treatment. At one point, the waiting time for non-critical patients at Queen Elizabeth Hospital was more than 7 hours. Over at Queen Mary Hospital, 3 hours at least. Choi Sik-hon, chairman of the Hospital Authority's Central Coordinating Committee, said some of the people waiting in line were COVID patients, but quite a lot of them were elderly patients who were sick because of the weather or their chronic illnesses. The hospital authority expects the number of people seeking medical help to approach 5,000 tomorrow when the long weekend is over. That's 1,000 more than the average daily number over the long weekend. Authorities urged people with mild symptoms to visit private doctors or hospitals. Meanwhile, with the city's daily COVID tally lingering at around 20,000 cases in recent days, many general outpatient clinics of the hospital authority have scaled back their services in order to allocate more resources to designated clinics for COVID patients. At the Lady Trench General Outpatient Clinic in Tsuen Wan, only medication review and wound treatment were available. The hospital authority stressed the situation may still be the same until after the Lunar New Year holidays. To cope with the rising number of patients, the hospital authority will add more temporary beds in hospital. It will also speed up discharge procedures for patients and shorten waiting time for admissions. Mimosa 9, TVB News.